Good morning, everyone. Today my topic of presentation is visual outcomes and prognostic factors in patients with traumatic cataract who underwent cataract surgery at a tertiary eye care center. Introduction: ocular trauma is leading cause of unilateral blindness in children worldwide. Aim of the study is to quantify the visual outcome in terms of visual acuity and prognostic factors after removal of traumatic cataract with implantation of an IOL. Materials and methods: this is a retrospective hospital-based study performed in a tertiary eye care center, Andhra Pradesh. Electronic medical records of traumatic cataract patients who received cataract surgery in a duration of 1 year period. Data included age, gender, causative agent, type of injury, surgical procedure done, wound location, initial visual acuity after injury, and final visual acuity. This is one of the case image showing traumatic cataract with temporal JD 3 o'clock hours after sustaining injury with wooden stick. Results: gender distribution: out of 179 patients, 53 were females and 126 were males. Males are more involved in traumatic cataracts in our study. Age distribution: majority of the patients were 25 to 40 years age group. Type of injury: majority of type of injury is closed globe injury when compared to open globe injury. We have compared the initial visual acuity before surgery and final visual acuity after surgery, and we found that 44.7% of patients achieved the final visual status of more than 6/12. 25.13% patients had 612 to 660. Visual outcome based on location of trauma: we found that poor final visual outcome in anterior plus posterior segment involvement when compared to only anterior segment involvement. The causative agent: the most common object causing traumatic cataract was wooden stick. Corneal involvement was the most common associated ocular morbidity because we found that more common pre-existing corneal scars in traumatic patients. We have done various types of surgical procedures, and we found that highest is SSCS with PCOL implantation was performed in 59.7% of patients. Phaco with foldable IOL procedure was done in 15.6 patients, and left FA kick in 9.4 patients. Coming to the discussion, most common age group prone to traumatic cataract is 25 to 40 years. We found predominantly in males. Closed globe injury more common when compared to open globe injury, and most common causative agent is wooden stick. Most common associated ocular morbidity is corneal scar. SSCS with PCOL implantation was performed in 15.7% of patients. Phaco with foldable IOL procedure was done in 15.6 patients. Left FA kick in 9.4 patients. 54.7% patients achieved the final visual status of more than 612. 25.1% patients had 612 to 660. Male predominance was consistent with the previous studies from other developing countries because they are involved in outdoor activities, sports, and playing with dangerous objects. Krishnamacharya and Rati et al. Also found that wooden stick is the most common agent causing traumatic cataracts. Corneal involvement is the most common associated ocular morbidity parallel with the earlier studies. Similar to our study, visual acuity of more than 618 was obtained after surgery in 43.7% of patients in a study done in North India. Lonkor and Petrick has also shown a better visual outcome on follow-up of patients with traumatic cataract surgeries. Coming to the conclusion, traumatic cataracts causes significant visual impairment, psychological stress, and a significant economic burden. Prognostic factors being initial visual acuity, injury type, wound location, posterior segment involvement. Satisfactory visual results can achieve with absence of posterior segment involvement and corneal scar away from the visual axis. There is a need for adequate health awareness education as well as early prevention. Early intervention with IOL implantation can achieve the good visual outcome. These are my references. Thank you.
Good presentation. You are in time. Thank you.